Hello friends, welcome to Cortex YouTube channel. In this video, we are going to interpret an ECG sent by one of my intern. So, what does the ECG show here? Yeah, let's begin step by step. Let's look at the ECG. So, first thing that you have to know in the given ECG is rhythm, whether the ECG is in sinus rhythm or non-sinus rhythm. So, how to know that? For that, you have to look at the lead 2. So lead 2, this is P wave, first positive wave, this is QRS complex, and this is T wave. So every P wave is followed by QRS, P wave followed by QRS, P wave followed by QRS, and there are RR interval is regular. Okay, so this is in sinus rhythm. Next thing that you have to ensure is rate. Yeah, before interpreting any ECG, you have to make sure that it is taken properly. So how to know that it is taken properly? For one thing is that is a standardization. That paper should move at 25 mm per second, and the voltage standardization should be 10 mm, means 1 millivolt. So this ECG is taken with standard normal standardization. So assuming that yeah, we just know the ECG is in sinus rhythm, and next we have to calculate is rate. So how to calculate rate? Whenever the rhythm is in sinus rhythm, you have to calculate rate by 300 divided by number of big boxes within 2 hour wave. So for that also you have to look lead 2 only. So how many big boxes are there? This is one big box. Inside that there are 25 small boxes, sir. So one big box, 2, 3, 4, 5, almost around 5 boxes are there. So 300 divided by 5 means around 60. So it's borderline bradycardia. So borderline bradycardia. So rate is in normal limits, sinus rhythm is normal. So next thing that you have to calculate is axis. Although here the finding is very striking, I am not going directly to the point, but I want you to interpret every ECG step by step like I am doing now. So rhythm is sinus rhythm. Rate is 60 beats per minute around. Next thing that you have to calculate is axis. For that you have to know lead 1 and AVF. For in that you have to look at the QRS complex. It is predominantly up. Here also it is predominantly up. So normal axis. Axis is normal. So there is no axis division. So everything looks normal. But what happened here? Look at the P wave, QRS and T waves all looks normal. Now after ensuring that all the waves are normal, you have to come to the point of intervals. So look at the interval. First interval we come across is PR interval. PR interval simply means starting of the P wave to starting of the QRS. So if you look at this PR interval here, it is, see, from here to almost here. Okay, one big box and 4 small boxes. So 5 plus 9, 5 plus 4, 9. 9 means how much? So it's almost around, see, 2, almost, it is almost 2. Let's consider it as 2 boxes only. So when you consider it as 2 boxes, it's more than 240 milliseconds. Sorry, one big box means 200 milliseconds, sir. Oh, 9. So 9 into 40 means 360. Almost it's coming around 360 milliseconds. Okay. So when it is more than 300 milliseconds, what is the normal PR interval? It's 120 milliseconds. Anything more than 120 milliseconds is abnormal, that is prolonged PR interval. So what does PR interval signifies? So I'll write here PR interval is 360 milliseconds. Anything more than 300 milliseconds is what is known as marked PR interval, marked prolongation, and anything more than 120 milliseconds is prolonged PR. So PR interval tells that current is going through the AV node. So PR interval talks about AV nodal conduction, AV nodal conduction, AVN conduction. So there is delay in the AV nodal conduction. That's why there is PR interval is prolonged. So since every PR interval is equal. See, look at this here, here. So every PR interval is constant or constant prolongation of PR interval is there. So this is first degree heart block. So what is the first degree heart block? It is constant prolongation of PR. Every PR interval is prolonged and it is constant. It's not like one PR interval is 300, second PR interval is 360, third PR interval is 400. It's not like that. Every PR interval is here, it is 360 only. So what are the causes of first degree heart block then? There are so many conditions like vagal tone, increased vagal tone that you see in athletes, vagal tone. So this first degree, how it will present to us? Most of the time it will be incidental finding. So patients won't be having any symptoms. They will be coming for fitness or sports fitness, job fitness, anything. So in that, as routinely if you get ECG done, you may get this prolonged PR interval, and they won't be having any symptoms when it is isolated first degree heart block. So athletes, one important thing, inferior wall MI is having prolonged PR interval. How to identify inferior wall MI? There will be 2-3 AV of ST elevation. So any mitral wall surgeries, myocarditis, and AV nodal blocking agents like your ABCD, adenosine, amiodarone, beta blocker, calcium channel blocker, D for digoxin. So all these causes, these are AV nodal blocking agents, and they will cause first degree heart block. And as I said, it could be normal variant. Okay, yeah, this is about first degree heart block. Hope you understood this video. If you find this video informative, please like, share and subscribe. Thank you.